Good morning or good afternoon, depending on where you are logging in from. We will just give our attendees a moment to join. I am so excited. It is day 3 of the 2024 Within Health Summit, and I am joined this morning by friends and colleagues, Angela Goins and Dr. Whitney Trotter. So this is going to definitely be a interesting conversation full of information that I am looking forward to having. As you all join us today, I will go over just a few housekeeping items before we officially get started. I know that there have been questions about your CE certificates. And yes, typically you are able to download your certificate immediately after the presentation, but because this is not a single session event, this is an event that is happening over 4 days. We are going to have the CE certificate available for you at the close of the conference. So that will entail all the hours that you have earned over the last 4 days. If there are any questions regarding your CE certificate, you are welcome to email me, and I will be happy to make sure that we get all of those logistics worked out for you. Also, if there are any technical issues regarding CE Go, I will also provide that information for you as well so that you can contact them. So with that being said, I officially want to welcome everyone to the 2024 Within Health Summit. My name is Jamie Singletary. I am the Director of Clinical Brand Development for Within Health, and it is my pleasure to welcome Angela Goins and Dr. Whitney Trotter. I will read their bios, and then I will allow them to introduce themselves to one another, and then we will get into our discussion. Dr. Whitney Trotter is dually licensed as a psychiatric nurse practitioner and registered dietitian. Whitney has over 14 years of experience working as a registered dietitian, serving the HIV/AIDS community, as well as working in the eating disorder field. Whitney has previously worked at a level 1 pediatric trauma center as a pediatric emergency room nurse. In addition to working as an RDN and RN, Whitney has served as a member of her county's Rape Crisis Center. Her work at the Rape Crisis Center equipped her to co-found an anti-trafficking organization, Restore Corpse. Dr. Trotter primarily works now as a psychiatric provider specializing in anxiety, mood disorders, eating disorders, and women's health. This past year, Dr. Trotter co-led the third BIPOC Eating Disorder Conference with Angela Goins. The past 3 years, they collectively have trained over 1,000 clinicians with their conference. Dr. Trotter has been featured in publications such as Essence, The Skim, CNN, and recently participated in a policy brief in Washington, D.C. for the National Black Caucus. Angela Goins is the owner of Rooted Nutrition Services, which is geared toward supporting those with marginalized identities who struggle with eating disorders and disordered eating behaviors. Angela currently provides individual nutrition counseling, facilitates support groups, provides supervision, and offers consultation services. Angela has experience working in various roles of intensive care for eating disorders, chemical dependency, depression, anxiety, and trauma. In 2022, Angela co-created the first ever BIPOC Eating Disorder Conference. This multi-day virtual event was developed to better meet the needs of those often overlooked, from inadequate diagnosing to traditional treatment models. This conference gives a platform for any clinician in the field of eating disorders to learn from an expert lineup of BIPOC providers who presented on an important variety of topics. Welcome, Angela and Dr. Trotter. It's my pleasure to have you both here today. And I was just sharing before we went live that we've never met in person, but I do feel like I know the both of you extremely well. And I would love for you to share with our audience how the two of you met.
Oh my gosh. Okay, you go first, Angela, because I always miss like important details in the story.
Well, well, we get this question a lot, and we're like work BFFs and business partners, and we're not really sure how we met. So I really, it's the good old fashioned internet. Like this is what happened when, we started doing so much over Zoom and checking on social media. And honestly, it was like, hey, another Black RD doing this work in this field. I need to know you. And so that is really how, for many years, we connected, communicated. Like we still, I don't know, Whitney, you jump in, but we can't remember the exact connection or how that happened. But it was
Yeah.
definitely just online, and it really, obviously the reach is so much farther because we're in two different states. I'm in Minneapolis at the time. Whitney was in Memphis, and
Yeah.
so we weren't near each other. We wouldn't have crossed paths like at meetings or worked in the same spaces. So it was honestly and then the pandemic enhanced that, but honestly it was a good old-fashioned social media internet connection, and just hit it off
Which
and went from there, right?
Yeah, which is also so interesting because both of us were like new to social media. Like I think I had like a personal, but I think I just started a work Instagram on like 2019, and Angela is not like wasn't super big on social media. So it's funny. And then we met in real life 2022. Yeah. So
Yes.
I love that. I think that's how I met the two of you as well. I think it was good old internet. I love what you said, Edge. I think it was the good old internet. And we hopped on and we did an Instagram live together. And then we couldn't wait to participate in the BIPOC conference, which brings me to how did the two of you come up with putting a conference together that really highlighted and shined a light on marginalized populations, a demographic of individuals that are very rarely mentioned when we speak of eating disorders, and there are talks and presentations, but you two took it to the next level and created a whole conference. How did that come about?
yeah, so it's so interesting because Angela and I laugh a lot about this. People thought that we were like new dietitians when we like kind of started talking about our ideas and hopes for the conference, but Angela's been a dietitian for a while, like almost 20 years, maybe. I'm 15, I think, at this point. And so we had spent the majority of our career in eating disorders. But again, like there's so few people that look like us. And we had both been to like national conferences. And so I had just a very traumatic situation happen in 2021. And Angela and another colleague were like, what do you need? Like, how can we help you? And if you know Angela and I in real life, our personalities are similar but very different. Angela's like the most detailed, organized person, like truly, like we are so compatible, and I am not. And so I called her and I was like, I have an idea. And she was like, oh Lord. And I was like, I need to do a conference. Like, I think that's what would help me right now. And she was like, you think we need to do a conference that would help you? And at the time, I think it was like February, and I said, yeah, and I think we should do it in May. And
Oh,
Angela
wow.
was like, And so we ended up deciding, July is BIPOC Mental Health Awareness Month. And so we ended up deciding to do it in July. And I, at the time, I was like, yeah, like maybe just, we could do 75, 100 people, and having no idea how this thing would really just blow up and be like a very safe space for people. And I think that first year we had almost 500 people that registered, and we had people from, I think at that time, 3 or 4 countries that ended up participating. So it was, yeah, just a really unique experience and opportunity that, like, honestly, originally birthed out of this like very painful time in my life. So,
Mm. Angela, would
Yeah,
you?
little did she know what kind of she was about to birth another baby with the conference. Like that is quite the undertaking, of which we had no idea of what we were. We had some idea. I mean, we've certainly been in the field, but like to create a conference on top of our current full-time roles, of which we have many. Her and I are always juggling multiple things in the air with our career, and then we also have family and young kids, and next thing you know, we're like, let's just start something else. And it was quite the undertaking, and it took off so quickly, and yes, went really well. We had lots of people register, but it was a huge learning curve for sure.
The BIPOC conference, like our summit, I believe is 3 years old, correct? And what have you all found to be the most enlightening thing as you do this each year? Do you find that it gets easier? Do you find that it gets a little more difficult? What has been the pattern in doing this annual event?
I would I'll just jump in and say I think that a lot of parts on the like back end business ends side of things are getting easier. Absolutely. We know how to be 10 steps ahead of ourselves this time. We know where we need support and where we've needed to like reach out and ask for help. We've had interns and other colleagues really be super supportive. So that piece gets easier. I think we really want to continue to bring new faces, great content, wonderful speakers, highlighting people doing great work that aren't normally, spotlighted. And so I don't want
Well, Angel, I think you froze.
I think she froze too.
Okay. Yeah, I'll pick up where she left off. So I think I agree with her in the terms of like the business side is getting a little bit easier. What I'm so excited to see though is just the way that like especially y'all at Within, like the embracement that we're having in the ED field. Because again, like this started because we just weren't seeing people that looked like us. And had similar identities and experiences at a lot of these conferences. And so I think looking back again, it's only been like 3 years, which is not a long time, but I see so much growth in that.
No, I agree. And I think too, from a BIPOC lens, which is the focus of this conversation, we've even seen just with our own internal program, with our BIPOC program that we have here at Within, just really trying to figure out how to create that space and make that space very genuine, make it feel safe, and also use allies of BIPOC communities to also support these efforts and have these conversations. I think something that's very important is to make sure that it's just not people that look like us having these conversations, but that our colleagues are also jumping in and supporting and understanding how to level the playing field, if you will, when it comes to eating disorder support, treatment, and care. What long-term impact do you envision the conference having on the BIPOC community?
Oh gosh. That's a good question. I honestly just really hope that it can continue to be a safe space and a catalyst for more community and conversations. Like, and again, I think it's so important, like, you know, BIPOC people are not a monolith. Like there's so many different unique perspectives, ideas. And I feel like I learned just as much. Like I love just participating and absorbing and listening in our conference because I feel like each speaker, each year, I'm just learning and just yeah, learning so much and taking away so many new things. And how can I be more inclusive? How can I be more culturally sensitive? How can I, lean into our differences and respect our differences? And I think as a provider, I always say like for me there's no ego in the game. Like I'm not afraid to ask and pivot and consult somebody else, and if there is a better person that needs to be helping you along this journey, let's bring that person in. And so I hope that that legacy will continue, and I hope that we can, my biggest thing is I hope that we are able to continue to be that bridge to educate more people on BIPOC eating disorders, and we are bringing in more providers who do look like us to work in the ED field.
I agree. I think it's definitely a village concept. I love the theory that it takes a village because it truly does. And working in this field, we definitely are reliant on our peers and our colleagues to provide insights, suggestions, and support, not only from treating the clients, but also supporting us as we do this work. We're humans and we feel things, and we're often coming to the table with lived experiences that need to be honored and acknowledged. And I think doing that in a way that embodies community is very supportive and just kind of creates a sense of success for conferences like this. How do you engage the community? How do you go about making sure the community knows about this event and how they can participate? And a second part to that, and not feel isolated, because when we talk about things like BIPOC or situations that could be considered sensitive subject matter, sometimes people stray away from those conversations, or they don't, work with that particular client or don't have a skill set. But how do you engage the community to let them know that this is a safe space and we want you to be involved?
Yeah. That's a great question. So in our like other professional life, Angela and I do a lot of supervision and consultation with various colleagues, and so I think we naturally try to embody that in like our day-to-day professional and personal life. And I will say too, like I love our chat room in our conference. It's very engaging. Yeah, I think it's very engaging and it's very just responsive. And I think, and you know this, right? Like hosting anything virtual is really hard because people are almost like virtualed out. And so we do try to build community virtually. And so we will have like the BIPOC networking hour. The first conference we did, we had a very safe space for like allies who really wanted to lean in and ask like questions like that are vulnerable questions, but that might create a sense of shame, but like really wanting to know these things. And so we had a very safe space for them to be able to ask questions, somebody who is trained in anti-racism education. And so each year we do try to create these kind of like safe micro community and like our larger community as well. Next year we are hoping to have the conference in person. And so we will likely have smaller like special interest groups too for people to build and foster community as well.
I like that, and I think it being in person will add a different element to the conference, a different energy, a different way to connect and physically meet, one another. While I do love the virtual space, there is something about being able to be in person. And speaking of BIPOC, if you're not working in this field or familiar with the term, there are some people that don't know what BIPOC means and sometimes often question, is it necessary to have a space dedicated to BIPOC individuals? What would you say to those people that are in question or sometimes wonder if it's a necessary space?
Yeah, I actually get that question a lot. And again, I would say prior to 2020, when we really weren't using the term BIPOC, so it is kind of fairly new, we were still like, communities of color obviously have always existed and we've always had similar um, just like yeah, we've always had similarities kind of bringing us together. But in the ED specific and in the ED field specifically, prior to 2020, you did not see people that looked like us that were in executive positions, that were, being keynote speakers, that were leading breakout sessions, that were involved in research, involved in policy. And so what happened is you started kind of having these like just isolation, like silos. Like again, I'm not a new dietitian. Angela is not a new dietitian. We've been around for a very long time. But we just didn't know each other because there's so few of us. And so I do think it's important to have that cultivated space and not just for BIPOC people, but I think anybody that share, some similarities of different, religions. Like I love that we're talking about different religions in the ED space and how we can be more inclusive, different, indigenous practices, heritage, cultures. Those things are so important because they really do shape how we identify and can influence different aspects of our life. And they should be shared and embraced. But you should also be able to share some of these things with people that, are like you.
I agree. When we were thinking about the BIPOC program here at Within, we were in a leadership meeting and a colleague, and I'm going to shout this colleague out. A colleague by the name of Kate Scafati said, I really wish we were doing more when it came to working with clients of color because at the time we just didn't have very many. And we see that often, right? There's no secret that you go into a program or you're working with a particular treatment provider. And when you talk about eating disorders, there aren't a lot of people of color that are enrolled in the program. And the research has shown that people of color are grossly underdiagnosed and sometimes not even screened. Just self-disclosure, I've never been asked if I've had an eating disorder. I've been asked about appetite, but none of my providers have ever asked me if I had any issues with food. I've been an athlete majority of my life, a dancer, never been asked. And so you wonder, if we were asking everybody the same questions, regardless of what they look like or regardless of what type of biases that we hold, would
Yeah.
these numbers look different. I always like to think about double consciousness. The theory from W.E.B. Du Bois talks about, having to conform when you are the marginalized population living in a predominant society that's different than yours, with cultures and norms and beauty standards, whatever it may be, some of the elevated stress and strain that can cause. And knowing that when we're living in a place where there are people that are suffering with this double consciousness, do they have a place that is safe where they can go? And I think programs like, or conferences like the BIPOC creates a space, and I think begins to communicate that we see you, that we hear you, and hear it within. My colleague Malika Crosby, she and I, really got together to figure out how can we create this space. And sometimes the participation will ebb and flow because it's new. It's new for people to be able to be in a program and talk about how their culture or how what they look like, has impacted them and their eating disorders. And we have a wonderful team. And I have to shout, my team out, because these colleagues show up every week doing this work. I have Crystal, Deja, Morgan, Chantel, Tessa, Tiana, hope I don't leave anybody out, Tina, Kath, Malin, just a host of people that work to make sure, whether it's directly with client care or behind the scenes, to make sure that we are communicating that we are a safe space. And I see that with your conference. Each year I see more and more people, and you all are not afraid to call out people that should be at the conference that may not be there. I thought that was hilarious, and I was so happy to say Within was in the building with you guys who were calling roll on who needed to be there. But I just appreciate you creating a space and saying it's okay, to show up exactly how you are,
Yeah.
exactly what you've been through. And we hear you, we see you, and let's work through it, and let's do some good work, and let's start to heal. So it's very, very refreshing to know that this space exists. And how can people learn more about the BIPOC conference? I definitely want to give you some time to talk about how people can learn more and register for events or support you all.
Yeah, absolutely. Absolutely. Oh, Angela, are you back? Yay.
Back, she's
Um,
back.
Yay. You were a mess, my friend. You're a mess. That was so funny. I was laughing when you were talking. I don't know why, like if anybody's familiar with like HBCU culture, but like the roll call is what it like brought me in that frame. But yeah, I will say I do think that is one area we can and really improve on, is getting the word out there. We do our only kind of means right now of just getting information out about the BIPOC conference is through social media and like our newsletter and email. Again, it's just the two of us, and then we have another colleague that graciously volunteers her time, and an intern. And so I would love to see the BIPOC ED conference be able to navigate the landscape of really pushing, social media, LinkedIn, other ways to get the word out there. But right now, people can primarily find us, and we'll put it in the chat on our Instagram, email. We try to do a lot of Facebook promos as well. Angel, I can't. That's pretty much it. Am I missing how folks can find out about us? I'm hoping in the future we could do a newsletter and spotlight several of our BIPOC colleagues as well.
Share, if you send us an email, you can get on our little blast list so that when we do get the 2025 site out and we get all set up, you can get in on that early bird pricing. Just have to provide your email. We don't, like Whitney said, we don't do a newsletter or send too many emails, to be honest, but we definitely will get the word out to you.
We missed you, Angela. And before you hop back, I was just laughing at how you all did a roll call and called individuals and programs out that needed to be at the conference, at the BIPOC conference, that were not. And I was saying I was happy to say that Within was present and accounted for. And
Yes.
We're not just registering, we were showing up, we were
Yes.
participating, and we had staff join, and we were there for all the things. So we just, thought that was funny. Shout out to HBCUs. I'm a graduate of an HBCU. We love a good roll call.
Yes,
Absolutely.
we appreciate your support over the years. I'm pretty sure Within has been a supporter since the beginning, and so we appreciate that. And I'm sure Whitney said this, but just to like put out there to everyone, it was like such a grassroots effort. Like we can't just do it on our own. We really needed the support of treatment centers, clinics, dietitian, like individual solo entrepreneurs. Like we just had not only the support from people, but yes, people to show up, participate, spread the word. I mean, it's for everybody to come learn. I know people get a little, they're unsure, like, well, I don't feel like I fit in the BIPOC category in some way, or I don't feel like this is for me. It's for everybody. We're just going to highlight the BIPOC individuals doing amazing things. So, we definitely want people to do a little bit of unlearning if that's the appropriate language. But like, if we can catch people from the start, like in college and internship and training, we don't have to like rework what you've already learned. We can just start growing these people, planting the seed, growing these providers to be far more well versed in working with a diverse set of clients and hopefully colleagues in the field. So
Speaking of amazing work, can you share some examples of positive outcomes or success stories from participants that have attended the conference? What type of feedback do you all receive after the conference is completed? What are some things that stick out that really moved you and, kind of motivated you and reminded you like, this is why we do the work? Because sometimes when we're doing the work, we often ask ourselves, why am I doing this? And then that moment will happen where we'll hear a comment or we'll get an email or someone will say, "Hey, I went to your conference and it changed my life." Do you have any examples or stories like that?
I know a common theme, Whitney, if I can just jump in. I know a common theme from so the final feedback evaluation and survey tends to be like, I have never heard this topic talked about before, or why have I never seen anybody speak on this? And I think what happens at conferences is you tend to get the same experts speaking on the same topic, using their same slides, and almost saying verbatim from this conference to the next conference to the next conference, just like season to season. And you can pay to go to those things and hear the same thing over and over from the same faces. Or you can come to ours and ones like this, where you really try to provide a spread of options for people, fireside chat, panels, amazing speakers doing research in their little neck of the woods that people don't know about. So that's kind of a common theme. I wish I would have pulled some actual comments, but we hear that a lot where people are like, their mind is blown. They say this particular person or this particular day, I was on the whole day. I was taking notes and I found it to be so mind blowing. I was learning so much, and it's hard to, you think farther you get, the deeper you get in your career and even into your like little niche. It's like I'm not sure there's much left for me to learn here, or I'm kind of like unsure what else there's left to help sort of grow me in my career. And I think that oftentimes that is the feedback that we get. So I don't know, Whitney, if you have anything to add to that, but
Yeah, I will say this, like we're not afraid to have people on there that are experts in their niche that aren't necessarily like the common faces that you see in the ED field, like Angela said. And so what it does is like I remember last year our opening speaker, and we're not afraid to have hard conversations, like or sit with discomfort. And so our opening speaker, they were two indigenous providers. One was a doctor and really talked about what it was like providing trans care on their reservation. And it was hard because there was some weight stigma that was intertwined in there. And so it was hard kind of navigating that, but that was so real to res life and their perspective. And you don't hear that. You don't hear from two-spirit individuals a lot in the ED field. This year obviously was very emotional. I cried more than I think any other year. We just had some very real, honest, raw topics that for me, I'll just say, I think the ED field did not want to hear and kind of glossed over, but these were the things that providers and people that are living with EDs were like, this is what I'm navigating through. And I will say, Angela and I both have pretty diverse practices. And so that influences sometimes the topics too, of like, okay, this is a common theme. Like we had 2 years ago Allison Inez, who has been doing ketamine. Her and I talk a lot. I'm very familiar with Spravato. She does ketamine assisted therapy. You're not hearing that a lot now it is being brought in, but 2 years ago you weren't seeing this at a conference. And so we're like, yes, we need to have this, so we believe in having people with identities and lived experience do these topics, and it doesn't matter to us if they've never presented before, because we do value all voices and really wanting to create that space. So I would say that's one of the things I am the most proud about, is we're not afraid to shy away from controversial hard topics that need to be talked about in the field. So
I love that, because we have to have these conversations. And when we shy away or don't engage in these conversations, I feel like it's a missed opportunity. It's a missed opportunity for us as professionals to grow. And it's a missed opportunity for our clients to be able to see us do the work. I think a big part of being a provider is also modeling the behavior. It just is not one thing to say, just do it. People like to see it. People like to see it in motion. And that space provides that. It provides a space to do the hard work, right? We always tell our clients that nobody said it would be easy, but it will be worth it. And I think that anytime it's worth it, it is a proud moment. We do have a question from the chat. One of our attendees, this is an anonymous question, says, do you have space for BIPOC identifying providers to be added to a resource list?
yes, we did create several years ago our own BIPOC ED database, so we can send that link, and you can add information. And if you are not a BIPOC identifying provider, you can use it to refer. We'd love for people to be able to use that. It's listed by specialty and state, which I think is really great. And some people have put if they take insurance, cash pay, all that. So we can put that link in there.
Yes, if we can add that link in the chat, that would be
Grab it.
helpful.
It's also on our website if you have that, but I will pull that link, have it drop in here.
I also have another question that has been sent to me. Speaking of hard conversations, how do you all suggest you begin those conversations when you are not a member of the BIPOC community?
I would say I specifically try to seek consultation and supervision from people that don't share identities. So I'll shout out Dr. San Chang. I was working with a couple of trans clients a few years ago, and I wanted my clients to be able, like, they're not responsible for my learning and unlearning, but I also wanted to create a space where they could correct me. I'm like, listen, if I say something, just, please, like, stop me, like, correct me. It's, I'm not going to take it personal. And so I think inviting that therapeutic, like, relationship and that vulnerability of, like, I'm going to get it wrong, like, please feel free to give me that feedback. But then I think also, like, it's my responsibility to do the learning. And Dr. Shan Ching has taught me so much just about language and different things, different aspects. I love treating, like, high medical acuity. And so really working through just different aspects of that as it comes to, like, trans competent care. Like, what is gender affirming care? How am I complicit in doing harm? How can I be an ally? How can I better serve this community? So we're all going to be like, work with people, be surrounded by people who do not share similar identities. And so I think it's important to just own you don't know what you don't know. And I always say that I don't know what I don't know. And so how can I find out what I need to know to do less harm?
Just to add on to what Whitney's saying there, like, we don't claim to be experts. We don't claim to know everything either. And so we really want this we've created this space to be a learning environment. So if you're a provider and you're not sure, or if you're not even a BIPOC provider and you're like, I don't know, this isn't a place to shame anybody and say, this is what you've been doing wrong. It's actually a shared learning space so that you can come join in during that week and really learn about what you can, a lot of takeaways to learn what you can take back into your actual practice, and hopefully share with your colleagues to start doing things differently. Not that, again, that we're saying this is wrong or this is bad. We're learning new things right along. I mean, Whitney and I are hosting all the time. We're like, oh my goodness, like we're learning alongside of these wonderful speakers that we're bringing in as well. So it's just a place to learn and grow together. And if you want to do things differently, show up. And we really find that. We find, it's a 3-day, one year we did 4-day for the conference. And people, it's not just pick and choose, people show up. And it's quite amazing. Like our numbers are steady across the day, like hundreds of people attending all of the sessions. Like we thought, oh, people will have to go in and out of their sessions. They'll pick what appeals to them. But it's like pretty consistent across the board that people are staying on their computer, watching most of the sessions back to back or taking time off to engage. We also, if you cannot attend live, of course, do have the recordings, but it's quite amazing. Like it's really a space to learn and grow together. And if you want to do things differently, we invite you to join our conference for that reason. There's no like calling out or shaming people for perhaps having done things a certain way. We're learning and growing alongside of you as well. So.
In addition to the BIPOC conference, are there any resources that you would suggest or that you have found helpful when navigating this space that would be helpful for some of our attendees to know? Any books or any particular talks or anything that you would recommend?
I mean, Sabrina Springs. Oh my gosh, I cannot speak to you. I'm sorry. Dr. Sabrina Strings. I love, love, love Fear in the Black Body. I love Deshaun Harrison's Belly of the Beast. I love Hood Feminism is a great book to have as well. I also really there's a book, and it's like I can't think of it. I'm gonna have to think of it. But there's a book that I started reading recently. That was so good in talking just more about like the history of body politics. And I think anything by Dr. Roxanne Gay is phenomenal as well. Angela, I don't know if you want to add
I was
in.
going to throw in there, we had a speaker this year that who does a lot of social media.
Oh, Raven.
Yes, Raven created a resource list for us. So I'm trying to think if we added that. Yeah, we added that to our materials. So if you did attend last year, you can go back and see that. If you want to email us, she was open to us sharing as well. And I think we had posted it on our social media as well. But that was a great list of like online resources, podcasts, books, and things like that. But yeah, honestly, a lot of our presenters have done research or studies themselves, books they've written, and we always try to promote that because people are doing great work. Dr. Joy Cox.
Oh, yes.
Yeah, I mean, I really think there's a lot out there. People just don't, perhaps you have to dig. It's like when you search something, page 1 is maybe all the common, you know, people that you would expect to see, but dig a little bit deeper or go to page 2 and see that there are actually a lot of BIPOC clinicians doing great work that have published things that perhaps don't get as much excitement or spotlight or TV time or podcast time, what have you. But there's quite a few options. Maybe that's something we could add to our website this year too, Whitney, is some places that clinicians can some courses and books and things that people can start. That's a great, thank you, Jamie. That's a great idea just to kind of guide them. Yeah.
Yeah, I love another one that comes to mind is Noreen with RDs for neurodiversity. I've learned so much in terms of like RFID, working, with just neurodiverse individuals. We don't talk a lot about things like RFID in the Black community. It's there. Again, like I truly believe RFID in young Black children is the least diagnosed, not because it's not prevalent or there, but because we don't have pediatricians and clinicians that can you know, recognize that. And even though Noreen does not speak specifically to the Black community, there's a lot of common threads on working with BIPOC children. And, you know, it's hard. I was thinking about this, you know, food is very important. Black people are not a monolith, but one central theme is the importance of our food and seasoning. And it's hard if you don't recognize if you have a child that has sensory issues or is picky eating. Like that was not a thing in the Black community. There, there was never a holiday that I can remember where picky eating was allowed. You know what I'm saying? You go get the seasoned food, you go sit down, you go finish the whole plate. But now, like as I'm in it and I have a child that has extreme picky eating, I'm like, okay, even though these are like the cultural conversations and the cultural nuances I'm so familiar with, how do I take a step back and really realize like this is real, this is very important, you know, it's not like you almost feel like, okay, this is like a shame, right? And it's not that. It's like this is something that like, you know, we can talk about, we can figure out what are the safe foods, what are the foods that you are willing to try that, you know, are not causing you distress. And maybe that Thanksgiving plate is it's too overwhelming and that's okay. Let's get, you know, one or two things, let's go first. But these are questions that like again, I think it's so important that we're talking through and we're not just shaming, you know, because I had never seen a little Black kid be represented on an ARFID, and it is very real in our community, and it does cause a lot of stigma. And these are conversations again that we really need to be having. But when you understand that cultural aspect of food and you know holidays and just those things, it gives a different nuance to the conversation.
I love that because when you were talking, I was thinking about when I was growing up and just, kind of breaking these generational curses and these messages around food. And the food was prepared. There was not a lot of options. This is what we're having for dinner, and you're going to eat everything that's on the plate. We're not even going to look at the portion
Right.
size. You're
Yep.
just going to eat what's on the plate. And then also, growing up, I'm a 80s kid, kind of growing up, there were these commercials, right, where they would show these famished, children in Africa, and that they needed food, and they were starving. And that was often, kind of like the point of reference in my household. There are people starving, you know, in other countries. So therefore you need to eat everything
Yeah.
that is on this plate. And now as a mom, my son, I allow him to, have a variety. If he says he's full and there's still something on the plate, that's okay. He's full. We're okay. Whereas like when we were growing up, don't waste it. It was almost like, oh my
Yep.
gosh, you can't waste, that food. And no blame to our generation, our parents, growing up, they were doing what, the best they could at the time. But to our point, having these conversations, breaking these generational curses, allowing, different communities to share what their experiences have been like are so important. And time flies when you're having fun. We're actually down to 2 minutes. And I just would like for us to close and just, have you both share what is your hope and vision as the BIPOC conference continues to grow. What would you like for it to do as it, continue, as you guys continue to have it each year?
You want to go first, Angela?
Sure, sure. I know I missed the middle section here, but you know, I'm sure Whitney highlighted this, but we're really going big and trying to be in person this year. So that's kind of next steps is like bringing the community together, like seeing a whole room full of diverse providers and speakers, like in real life, will be so amazing. So my hope is really that people join in and people feel um, drawn to participate, drawn to come learn and be in community with us. We'll also have a virtual component. So if it's not possible or it's not accessible for you, I understand. But just that piece of like being in company and community with one another. We'll eat and break bread together. We'll learn next to one another. We'll have, social events and volunteering and all that. But I think for the conference itself, um, really just celebrating and growing together in community. And then I hope for the field in general that it really does start to like widen because we know that that eating disorders and disordered eating patterns affect everybody, all humans. This can be something that everyone is every culture and every person can be dealing with. And so my hope is that there's more RDs in the field doing this work. And I don't want to just say that without being honest that, the pay's got to be better, recognition, the burnout's got to be lower. Like, I know what that entails. I'm talking high level hope here. I understand I've been doing this for a while, but that there are just more BIPOC clinicians in general that want to do this work and don't get pushed out or pushed away, and that are definitely paid what their value and worth is, so that when clients are able to seek treatment, that there's actually providers who look like them and understand where they're coming from. And again, I am not prone. I'm fully aware that there's many steps in between that. But when you say hope, that really is my high hope, is that people want to join in for the right reasons, and that they deserve, the pay and the time and the support and the recognition that they deserve.
Absolutely. Yeah, I would say the same. I really hope that we can continue to create and cultivate these learning opportunities and spaces and have the conversation. I do think at times the ED field can be very polarized. So it's probably hard as a new person coming in, wanting to be on the ED field, trying to figure out like, what are my beliefs? What are my ethics? Like, where do I lie on these certain like topics and issues? And so I think continuing to have really hard conversations, but necessary conversations is something I hope that we can continue to do as a field. And, we can disagree and be in community. And I just think that's so important. I think that's so important to just really have these conversations to make us not just better clinicians, but just better human beings.
I love that. Thank you both so much for your time and your participation and sharing your wonderful gifts and knowledge with us this morning. I hope that you will stick around and join some of the sessions if your schedule permits. And for our attendees, thank you. This was a wonderful kickoff to day 3. The next session that we will have will start at, let me see, 11 o'clock. And that is going to be considerations of health equity in the emerging remote eating disorder space. So that will be happening here in just a moment. So thank you all. And again, thank you to my wonderful guests, Dr. Whitney Trotter and Angela Goins. Continue to do the work. We need you. We appreciate you. We see you and we hear you. Have a wonderful day, everybody.
Thank you.
Thank you.
Bye.